welcome to Your Health. I'm Beth Ruyak. Would you know if you or a loved one was having a stroke? The symptoms can be subtle. Do you think you'd recognize them? Every moment counts, though. As soon as a stroke begins, millions of brain cells start to die. And the only way to stop this is to get help right away. Take a close look at this brain scan. Do you see the hole, the void on the left? Neurologist Brian Richardson says that shouldn't be there.
32,000 cells die every second. So in just 1 minute, you lose like 1 million.
At Sutter Health's Ultimate Summit Medical Center, they say time is brain, and you can see why. Here at the Stroke Center, team members can actually pinpoint which part of a patient's brain is being damaged.
This sort of an image would be correlating with a person who has weakness on the opposite side of the body, as well as numbness.
It happened suddenly to Leatrice McWhorter-Russ, just as she and a colleague were ordering their lunch at Oakland's Geneva Delicatessen.
I was having a real bad headache. I started stumbling. I couldn't stand and I couldn't use my arm. And then my face drooped.
What would you do if these same things started happening to you? Hopefully you'll do what Leatrice did.
I asked him when he called 911 for me because I felt I was having a stroke.
And our job is to get there within 5 minutes or less, get him into the back of the ambulance as quickly as can and get him to that hospital so we can get him in under that 3-hour window for thrombolytic therapy.
We're talking about TPA, a clot-busting drug that can stop a stroke as it's happening. But it's important to note doctors only have about 3 hours to deliver this medication.
The technology and everything has improved drastically for caring for stroke, so there's lots of interventions, but we can't do it unless you're here.
And there lies the problem, according to stroke educators.
They found that 50% of stroke deaths in Alameda County actually occurred before people were arriving to the hospital.
There are still far too many people who don't know the signs, even though stroke is the #1 cause of adult disability here in the U.S.
Everyone needs to know about stroke symptoms.
Don't move.
It helps to understand the basics of how a stroke works. In the arteries, cholesterol and plaque can build up and lead to a blood clot. Sometimes part of that clot breaks off and travels through the bloodstream to the brain. That's a stroke.
The brain is deprived of blood flow, and the blood contains sugar and oxygen. And brain cells begin to die right away when they're deprived of sugar and oxygen.
I think that I had reasons to be concerned. I was overweight. I was 150 pounds. I was especially concerned about stroke as my mother had a stroke last year.
Leatrice knew she had some of the risk factors, a family history of stroke, and high blood pressure, high cholesterol, and high blood sugar.
When I got to the hospital, they kept saying, "Oh, you're so lucky, you're so lucky. You came right away. You were here within 15 minutes from the onset of the stroke." So I felt, you did real good. You did real good. You got there. Y'all see the hummingbird?
Today, Leatrice can walk,
heel toe, heel toe.
She can talk and move freely because her loved ones got her to the hospital quickly.
I said, I refuse to go out like this. I refuse to be crippled if I can do something about it.
And right now, Sutter Health stroke teams are reaching out to their communities to help more people achieve outcomes like Leatrice did.
In English, in Spanish, in Chinese, in Vietnamese.
They're showing people of all ages how to perform simple tests to determine if someone they love is having a stroke.
If they're walking normally, that's an indication that things are looking good.
Look for signs of weakness on one side of the body.
See if both hands are raising equally or if one is lower than the other.
Check the speech.
If the speech is slurred, that may be an indicator that the person's having a stroke.
Does the person seem confused or disoriented? When you ask them to smile, do their eye or facial muscles droop on one side? Do they have trouble wiggling their fingers equally with both hands?
The classic stroke symptoms are sudden onset of weakness, numbness, slurred speech, difficulty speaking, difficulty with vision. And the key thing is here, sudden onset.
Just have us come out and check you out. We'll run you in, we'll run some tests, and if it turns out that you are having a stroke, you're going to be at the right place.
And the stroke team has one more bit of advice. Take control now. Try to prevent a stroke from ever happening.
Stroke is actually referred to as the most preventable of all disabling conditions. Exercise, watch your diet, and take cholesterol medication if the doctor feels it's necessary.
Be proactive.
Want to help emergency responders act even faster? Here's a tip. Keep a piece of paper posted on your refrigerator with a list of your medications, allergies, and the name of your primary care physician.